I think what we were expecting is perhaps a wave of infection that went up and then came down again, and perhaps a second wave later. But what we're actually seeing is the first wave never ended. We've got a plateau with a much higher level of infections than we were really hoping for after the stay-at-home orders.
Is this simply because more people, though, are being tested?
Certainly, we've seen the ratio of deaths to cases come down. There's fewer deaths than people were predicting, and that's a good sign. And the testing capacity has expanded, so there are a lot more cases than there might have been, if, in previous months when there wasn't so much testing capacity.
Benjamin, it's Hadley out in Dubai. I just wanted to get a quick check on how you see this playing out with regards to government policy. We've seen obviously very different policies depending on the country. Here in the UAE, for example, we were in total lockdown between Dubai and Abu Dhabi several weeks. Now, in the last 3 weeks, we've seen Dubai totally reopening the economy while Abu Dhabi's remained locked down. And now, in the last 24 hours, the announcement coming from the Dubai government that we're going to be able to travel back and forth now, in and out of the country, and that visitors, tourists, will be welcomed back in July. I mean, who's getting it right, do you think? And is it just hard to tell?
I think it's really difficult. So stay-at-home orders are probably the most effective weapon in the toolbox, but we can't do stay-at-home for another 6 months or 12 months because that's going to kill the economy. So instead, what we got to find is a balance between maybe not completely stopping COVID, but keeping transmission as low as we can, protecting elderly, protecting vulnerable populations, but at the same time trying to get a little bit back to normal. And I think some places in the world may go too far towards opening up too quickly, and they're going to see, unfortunately, spikes in cases. Other parts of the world, if they stay shut down for too long, there's going to be other longer term consequences of that.
And what happens next, do you think, Benjamin, with regards to the United States? Obviously, President Trump is in great disagreement with many members of the medical community as to how to tackle this virus going forward, including how it should impact his campaign. Do you think that that's just a mistake to hold massive rallies at this point?
So that particular rally wasn't as massive as perhaps some people had imagined it might be. I think going forwards in time, we recognize there's going to be disagreement between medical experts and economists and other groups of people. The medical experts are going to be very focused on protecting people's health, and that's what I would do as well. So I think we've got to try and minimize transmission, minimize the number of infections, minimize the number of hospitalizations and deaths. But at the same time, the president's role is to protect the economy and protect society as well. And so he's got difficult decisions to make that I think a lot of people are going to be unhappy about.
Right, the US has said that it won't shut down the economy again, but do you see a second round of shutdowns coming? I know here in Singapore things were relaxed at the end of last week and there are a lot of people out on the weekend, but taxi drivers and the like that I was speaking to said enjoy it now because they all think that a second lockdown is going to come.
I think the first round of stay-at-home orders going back to April and May were across almost all of the US. I think what we're going to see going forward in time is much more targeted orders. So it won't be the whole country again. It will be certain places like Arizona or Florida when case numbers spike and hospitals fill up. Then we'll see a month of stay at home, whereas other parts of the country stay open. But that's going to be really difficult to coordinate and to get right.